everyone, my name is Jamie Corsa at Wilson State College, and today I am going to demonstrate Piggyback IV. So right now I am in my medication room. I have my patient's orders, my healthcare provider orders, and my MAR. And so right now I'm just going to make sure that I have the right patient. Shirley Coast, 54, date of birth 5/14/1964. And I want to make sure that they both add up. And so now I'm looking at my orders, and it looks like they already have a primary going, and it's sodium chloride, 1,000 milliliters at 100 milliliters an hour, and that adds up. And it looks like we'll be adding a ceftriaxone 1 gram and a 250 milliliters of normal saline infused over 60 minutes, and that looks like it adds up. So I'm going to perform hand hygiene and don gloves. For purpose of the video, I'm not going to don gloves right now. And I'm going to go over to my Pyxis and pull my medication and make sure that I have my tubing. So right here, I want to make sure that I have my 1 gram, and that is in 250 milliliters of normal saline. So I'm going to go ahead and take that out. And I'm just going to go ahead and I'm going to make sure that I'm looking at the bag. There is no leaking, there's no floating particles. So that is good. So I'm going to go ahead and I'm going to put my identification sticker, making sure it matches up with my MAR and my healthcare provider, Shirley Coast. And I'm going to put this on the back of the bag. It usually in real life would come from the pharmacy with it already on the bag. Okay, and now I'm going to go ahead and I'm going to head into my patient's room. I took off my gloves and performed hand hygiene, and now I'm going to head into my putting on my shield. Okay, so I have knocked on the door. I have performed hand hygiene, and I'm going to go ahead and provide privacy for my patient. So hello Shirley, how are you today? Good. Okay, so I'm going to go ahead and I'm going to administer a medication through your IV. You won't be getting poked again. It's just going to hang up with the other bag. The doctor did, he's going to give you some ceftriaxone, and that's going to help with your pneumonia that you have. So first I'm going to go ahead and have you verify your name and date of birth. Shirley Coast, 54, date of birth 5/14/1964. That adds up perfectly. Okay, and I'm just going to do another medication check. Again, I have my ceftriaxone, 1 gram, and 250 milliliters of normal saline infused over 60 minutes. Okay, and that both matches up. So now I'm going to go ahead. Again, I've performed hand hygiene, and I'm going to don gloves. And before I do that, I'm going to go ahead and I'm just going to look at her IV site right now that she has, making sure there's no infiltration before I add another medication, and everything looks good, and it looks like she is allergic to codeine. So now I'm going to go ahead and I'm going to prep my tubing. So what I'm going to do first is I want to make sure that my roller clamp is in the closed position. I'm going to go ahead and I am going to spike my medication. I'm going to go ahead and flip it, and I'm going to prime my chamber. Just holding it up here. I want to take this cap off. want to open my clamp, and I want to just make sure that it's going to prime. Ooh, there it is. Primed a lot. Okay. So I'm going to go ahead and close that. And I'm going to hang my medication. And again, just checking for a third medication check. I have my ceftriaxone, the 1 gram and 250 milliliters of normal saline infused over 90 minutes, and that all adds up. So I'm going to go ahead over here. And again, my primary is already still going. And I'm going to cleanse this for about 15 minutes. And then let that dry. And then I'm going to go ahead and attach my Piggyback tubing. Okay. And before I do that, I'm going to go ahead and take my IV tubing label, and I'm going to label my tubing because it's new. Okay. And so then I'm going to go down here and I'm going to start the infusion. So I'm going to hit B because we are piggybacking. And I am going to go ahead and go to therapy. And I'm going to go down to ceftriaxone. I will choose that. And dosage calculation. I know it's mils per hour. I'm going to go ahead and go down, and at the rate it'll be 250 mils per hour. And it's a 250 milliliter bag, so I do know that. And I want to go ahead and just open my clamp here, and then I'm going to go ahead and I am going to press start. Now that I see that the primary has stopped and the second one is going. There we go. Okay, so then I am going to go ahead and go over to Shirley. I want to make sure that I'm looking at everything and making sure that it's good. There is, again, no infiltration. I would let Shirley know that I am going to go ahead and be back in about, I'd say about 55 minutes, because we learned pumps aren't always reliable, and you want to make sure that you're there before it's done to check on it. So Shirley, if you have any other questions, I'll be back in a little bit to check on you. Okay, so before leaving, I would perform hand hygiene and take off my gloves, and then I would document. I want to document the rate in the milliliters per hour. I want to document how the patient handled it, if there was any sign of infiltration. I want to document the medication that was added as well as the primary. And I would like to, I would also document start time, end time, and how much the patient tolerated it, and any other documentation I would need. And that is it.